Welcome to Sandy Says. Today we will be discussing suicide, and Zuhura Namibia will provide feedback on the subject. Zuhura is one of our SA group leaders. September is National Suicide Prevention Awareness Month. That included World Suicide Day held on September 10th. This is a time to reflect on what suicide is, how it impacts people, and how to prevent it. Suicide is the act of a person killing themselves. A suicide prevent attempt is when a person tries to kill themselves. Not every action is successful, and not everybody thinking of committing suicide actually has a plan to do so. That is why it's important to ask a person questions like, are you thinking of killing yourself? Do you have a plan to kill yourself, and what is that? Do you need to call a crisis line or go to a hospital? There is now a 988 number that is the mental health crisis line. People can still call the suicidal hotline and text crisis line. There are also warm lines for people who are not in crisis but want to talk to someone. According to Schizophrenia and Psychosis Action Alliance, suicide is a leading cause of death among people living with schizophrenia, with up to 13% of people with a serious brain disease dying from this cause. Risk factors include feelings of hopelessness, social isolation, worsening health, and family instability. From National Institute of Mental Health, suicide is a major public health concern. In 2020, suicide was the 12th leading cause of death overall in the United States, claiming the lives of over 45,900 people. Suicide is complicated and tragic, but it is often preventable. Knowing the warning signs for suicide and how to get help can help save lives. Warning signs that someone may be at immediate risk for attempting suicide include talking about wanting to die or wanting to kill themselves, talking about feeling empty or hopeless or having no reason to live, talking about feeling trapped or feeling that there are no solutions, feeling unbearable emotional or physical pain, talking about being a burden to others, withdrawing from family and friends, giving away important possessions, saying goodbye to friends and family, putting affairs in order, such as making a will, taking great risks that could lead to death, such as driving extremely fast, talking or thinking about death often. And here are 5 steps you can take to be the one to help someone in emotional pain. Number 1, ask, are you thinking about killing yourself? It is not an easy question, but studies show that asking at-risk individuals if they are suicidal does not increase suicide or suicidal thoughts. 2, keep them safe. Reducing a suicidal person's access to highly lethal items or places is an important part of suicide prevention. While this is not always easy, asking if the at-risk person has a plan and removing or disabling the lethal means can make a difference. 3, be there. Listen carefully and learn what the individual's thinking and feeling. Research suggests acknowledging and talking about suicide may in fact reduce rather than increase suicidal thoughts. 4, help them connect. Save the 988 Suicide and Crisis Lifeline number, call or text 988, and the crisis text line number 741-741 in your phone so they're there if you need them. You can also help make a connection with a trusted individual like a family member, friend, spiritual advisor, or mental health profession. 5, stay connected. Staying in touch after a crisis or having been discharged from care can make a difference. Studies have shown the number of suicide deaths goes down when someone follows up with the at-risk person. Zuhura, please introduce yourself.
Hi, my name is Zuhura, and I'm a schizophrenic alliance group leader, psychosis and acceptance. And um, the follow up that usually happens after a person has release from their crisis. Um, is to aim to relieve the accompanying mental condition or other risk factors. If you focus on making people who have a mental disorder as well as they can be, managing life as well as they can, or reducing suicidal thoughts, you can greatly reduce overall suicide. Um, overall, says Dimiterchik. Medication can help. Antidepressants, antipsychotics, or talk therapy. Cognitive therapy is what they do and can help people learn new ways to deal with stressful situations by training them to consider alternative actions when thoughts of suicide arise. One of the most effective tools is the warning signs and quick action, as Sandy was talking about. We used to think that talking about suicide meant you weren't going to do it, but it's really the other warning signs include withdrawal, usual activities, a change of mood, or a change of sleep patterns, says Dr. David Brent, a psychiatrist at the University at Pittsburgh. Never ignore someone talk of suicide. You can ask directly if the person has ever thought of harming themselves or herself. You can also ask the question, use the QPR method, QPR and question, um, persuasion, and referral. You can the question, are you trying to kill yourself by suicide? And the persuasion would be tell the person that's a permanent solution to a temporary problem. And it do you really want to? It may affect others. And you can say, stay stay here tomorrow will get better. As you try to give the note, the referral and give them, would you like me to give you a number? And I can call it if you need me to. And the number is 1-800-273 talk 8255. To learn more, call that number. You can also call 1-800-950-6264. It's a NAMI number. Or United Way, which is a warm line, and it's 211. So I'm wanting to delve into some of the things that the scientists has researched. Okay, Solve Suicide by NIH News and Health, May 2012. Awareness and action can help save a life. Acting anxious, agitated, or reckless. What happens in the brain when someone is suicidal? We'll find systems in the brain that are broken with suicide, especially in the front part above the eye, called the orbital frontal cortex. That area of the brain is involved in inhibiting behaviors that are damaging, like being unable to inhibit the urge to kill oneself, says Dr. Victoria Arango from Suicide New York State Psychiatric Institute. When you're in a suicidal state, you're kind of closing down your options. You see it as a solution. You're not able to entertain any of the ideas, says Dr. Pearson, who heads the Suicide Research Consortium at NIH. And the scientists had also, from 20 years ago, said that known about the biology of suicide to people uncovered clues at greater risk for suicidal and actions. Suicide is the 10th leading cause of death nationwide, third leading cause of death with adolescents. Nearly 37,000 died by suicide in 2009, according to the Center for Disease Control and Prevention. More than half were from firearms. All genders are at risk. Ethnicities, men more likely than others, than women, because they choose more deadlier methods, such as firearms or suffocation. The, the biggest risks are white men within the age 85 and older have a rate of suicide that's 4 times the national average. Suicide, mental disorders, people with depression, bipolar, or had prior suicide attempts, and people that has a history of substance abuse and having guns in a home. Those are suicide risks. It's a higher rate. Over the decade, Dr. Orango and her colleagues have conducted detailed studies of brain structure and biology in hundreds of suicide victims. They have found that certain brain regions in suicide has um, fewer nerve cells and altered receptors for neurotransmitters abnormalities related to neurotransmitters serotonin have been linked to suicide studies. Scientists have figured out for these if these flows in serotonin directly to suicide, or more likely it's serotonin is one of the part of a complicated chemical pathway to suicide. Serotonin is also believed to play a key role in depression and response to trauma. So we have the stress, trauma certainly play a big role in suicide, especially early life stress, says Dr. Roger Dimiterchik, on NIH scientist who studies the molecular details of mental disorders. Several research teams have found evidence of traumatic childhood experiences, such as or violence, can tag certain genes in the brain. These tags, called epigenetic markers, are actually molecules that attach to genes. They have a lasting effect on whether the genes are turned off or on. Um, these markers were not found in suicidal victims with no history of no childhood abuse or in people who died in accidents. More research into stress affects genes and suicide risk might find new chances for early intervention. And you can um, carry on, Sandy.
Yeah, and I know for myself, I did not make many attempts because I was afraid of failing and making a tough situation even more difficult. Do you relate to that?
Yes, I had 5 attempts myself, and actually, I did want to kill myself. I just didn't want to live, you know. And I tried it, and then I tried to cover it up, and I tried it one time when I went to court, and I just didn't want to live. But they treat you so bad. If you go there, they make you drink all that charcoal and they mistreat you. You be thinking they're going to give you pity, but they don't. When you go in those hospitals, so that should turn anybody off from really being suicidal. So I'll never do that again. But then we can uh, really go to the question per, persuasion um, referral and be able to call those numbers that's available 24/7 and actually the follow-up would be to relieve the accompanying mental condition or other risk factors. If you focus on making people who have a mental disorder as well as they can be managing life as well as they can, or reducing their suicidal thoughts, you can greatly reduce suicidal overall, says Dr. Monique Douglas Minichi.
Well,
And
Zahara, thank you so much for being here today and talking about suicide. It's obviously a conversation people need to have to
mm,
protect people. Make sure you check out our YouTube channel, Sandy Says Interviews at Schizophrenia and Psychosis Action Alliance, so that you don't miss our next video. Thanks and have a wonderful day. Bye.